And thank you for joining us today. And it's my pleasure today to discuss with you and to share with you our experience at the WHO Regional Office of Africa with implementing the EIOS initiative in the African region. Can I have the presentation? So in this presentation, we'll start by talking about the context for us to better understand the importance of EIOS, the EIOS initiative. And then we will touch on the process of EIOS in the African region. We'll see some milestones and how we operationalize the EIOS system in the African region. Just 1 second to allow you to see my slides, please. Okay, great. So can we move the slides? Okay, so this is the plan of the presentation. We'll talk how we migrated from a old system to a new one. We will also touch on the expansion of the initiative in the African region, what challenges we've been facing so far, and our plan for the future. So you may ask why the EIOS initiative is important. We have to keep in mind the fact that in the African region, we are facing many outbreaks and emergencies. So given these emergencies, we need to be able to early detect these emergencies, to be able to protect the health of our population. If we are able to early detect, we will also respond quickly and we will mitigate the impact of these outbreaks and emergency in our population. And this situation underscores the importance of the EIOS initiative and the open source information. Open source information, including social media, blogs, non-traditional health information. I think all of us here, we are aware of the fact that many information are captured primarily by open source information. Even WHO, in its role of safeguarding the international public health, we need also to base or to rely on open source information, as open source information is the primary source of information of health threats. This is how we migrated from the old system, because we've been using the hazards detection and risk assessment system from 2016 to 2018. And then we decided to transition to a new system, which is the EIOS system. Why did you take this decision? First of all, because EIOS had more sources. We have more sources in EIOS, and in EIOS, we can also find more functions, more capabilities in EIOS, and it has an interface which is more user-friendly. So after the integration of the EIOS system in the African region, we also started the process of integrating this initiative among our member states. This is how we operationalize the public health intelligence in the African region. So the first step is the signal detection. We detect a signal, and then when a signal is triaged and it's become before becoming an event, we need to verify the signal. And for this, we reach out to our colleagues at the country level. Once a signal is verified and it's confirmed, we also carry out the risk assessment, which determine the level of response we need to how we can support the country. And then we also communicate all this information among our team, but also with other people among WHO and outside. So to use EIOS, we have created a couple of boards. but we have one, the main one. It is a all hazard board with all outbreaks, priority diseases, and other emergencies in Africa. This is used for a daily media monitoring. The main objective is to be able to early detect any new events. But apart from this context of detecting a new events in the African region, we also use EIOS for monitoring the trends of diseases, of outbreak. EIOS is also used to inform readiness actions in case of we are experiencing a risk of being affected by an emergency. So since we've been using EIOS, we have been able to scan thousands of articles. And you may ask, for instance, for the African region, has EIOS been useful for us? We have carried out a survey, some analysis from all articles, all events reported to the regional office. So from this analysis, we found out that 47 events reported to the regional office were initially detected by EIOS. It's almost half of these events. And over 80% of these events were also detected, but regardless of timing, but 47 before the official notification to WHO. So you can understand the importance of EIOS for the WHO African region. We also communicate about this event. We share daily reports about signal detected in the African region. And once an event is also confirmed, we share these reports. And for this, we rely on a dedicated team of epidemiologists. They are at the regional office in Brazzaville, but also across our emergency hubs. So the EIOS initiative is not only an initiative for the African region. We have been also involved in capacity building of our member states. The expansion process started in 2019 with the onboarding of Nigeria, followed by Rwanda and Uganda in 2020. As you see, we started slowly, but this process gained momentum in 2021. And so far, we have trained over 1,000 of users across 36 member states in the African region. We used many modalities, including face-to-face, online, and the combination of the two modalities. We have also benefited from the collaboration with our partners, including US CDC, Africa CDC, and so on. You can see in the following slides some pictures from some onboarding training in the African region. So apart from the onboarding or the capacity building of our member states, we don't stop our support just after the training. We continue to be in touch with member states already onboarded. Recently, we have launched a mentorship program. Why did we do this? First of all, it was a decision informed by a survey. We reached out to our member states, and it was clear that we need a post-onboarding support to operationalize the EIOS initiative in the country. So without this support, many countries were not using the EIOS system. And also another challenge we are facing with member states is staff turnover and reassignments. As you know, this can disrupt the continuity of expertise and it can interrupt the use of the system in the country. So what is this approach of mentorship program? It's a program which is hands-on and country need focused. So it depends on the need identified after identified also some gaps in the country. So we come to fill these gaps as part of this program. So far, we have already implemented this approach in 2 countries. Togo was the first one, and then in Namibia recently. But this program is meant to be routine, so it will depend on our engagement with our member state after the training. We've already made a lot of efforts, but we still have many to do. And we are facing some challenges. One of our primary challenge is, next slide, please. One of our main challenge is managing high volume of articles. In the African region, in our boards, our main boards, we scan daily over 2.5 thousand of articles. You can imagine how it can be time consuming, and cumbersome, and so on. For us, you can maybe ask, why do you have so many number of articles? So for us, we need to strike the balance between the sensitivity and the specificity. In other words, it means that we need to be able to capture all potential signal while not being overwhelmed by the false positives. So it's not really easy to strike this balance, reason why it's one of our challenges. The second one is related to master trainers. As you saw, the number of communities are growing. We need to have more people to be able to support these communities, because our support doesn't end with the onboarding. We have to continue to support these communities. Also, interoperability of other systems used in countries. We need also to add additional sources, looking at local languages in the African region and also radios. We need also to optimize the utilization of the EIOS and also limited resources. Next. So to address these challenges, first of all, regarding the large amount of articles to scan, we are developing a machine learning technique to classify articles within EIOS as signals or not signals. So this will reduce the number of articles to scan. And also we have this workshop with you, the EIOS Champions Workshop, which will allow us to have more people who can support the initiative. We are also supporting countries and connect them with EIOS. And also there is a project we call speech to texts, which will integrate even radios, because in Africa, some pieces of information are broadcast rather than online. So these are some activities and our challenges, and we aim that with the support of everyone, we will be able to address all these challenges. Thank you.
Thank you very much, Dr. Kambale. I think this is a very useful presentation. So we will take a few questions from the room. And I hope you are looking online for questions. We'll start with the room. Do you have any question for Dr. Kambale? Yes. Geoffrey from Tanzania.
Thank you. Thank you, Dr. Kambale, for the very nice presentation. Man, I have just one question. I'm so much interested with machine learning to classify signals in a system. So my question is that machine learning going to do like a triage or something else? Okay, thank you.
Thank you. We'll take a round of questions. Any other question? In the room? Do we have questions online? Okay, Dr. Kambale, is your machine going to do triage? Please tell us.
Okay, thank you for your question. Yes, machine learning. I think we will have an opportunity to learn more about machine learning as we move along. So what is the idea here? is to learn about past experience, what was classified as signal and not signal. So the machine will learn from this experience and it will be able to classify what is more likely to be a signal and what is not likely to be a signal. So it will a little bit classify, and we will need to focus more on what is likely to be a signal, and we will have less article to scan every day.
Thank you very much. Any other question from the room? If there's no other question, let's give Dr. Kambale a hand of applause. So we will now move to our next presenter. Our next presenter is Ms. Hadja Fatoumata Bangura. She is an event-based surveillance analyst and the National Surveillance Officer at the Ministry of Health of Sierra Leone. She has over 5 years of experience in public health surveillance and concurrently serves as the EIOS focal point for Sierra Leone and co-auditor of the country's weekly epidemiological bulletin. Distinguished ladies and gentlemen, let us give a hand of applause to Madam Bangura.
Good morning, good afternoon. I'm Hadja Fatoumata Bangura, event-based surveillance presenting on behalf of Sierra Leone. This is my presentation outline. First of all, I want to introduce you to how surveillance started in Sierra Leone. And this is the presentation for disease surveillance in Sierra Leone. In 2004, the Sierra Leone adopted the first edition of the Integrated Disease Surveillance and Response Strategy provided by WHO AFRO, and for the control of communicable diseases. And we are focusing only on 22 priority diseases. And we are now on the third edition with the scope of focusing on 48 priority diseases now we are surveillancing. And in 2012, there was a cholera outbreak that was declared as an emergency, national emergency in Sierra Leone, and followed by the Ebola virus in 2014. After the Ebola virus, the country health system suffered a severe shock. And because of this, it took a heavy toll on the health forces, which took about 221 deaths. And after the Ebola outbreak, Sierra Leone embarked on a journey to revitalize the disease surveillance system. And this is the area of revitalization from 2015 to 2024. WHO guidelines, WHO AFRO provide technical guidelines, training materials and reporting tools were introduced, staff were being trained on IDSR, and it's now being implemented in all health facilities across the 16 districts in Sierra Leone. And also in 2019, the National Surveillance Program developed a tool for the monitoring and evaluation, and it's now implemented and still sustained. And for data validation, we are proud now to say Sierra Leone, the assurance of data has improved to 98% due to the last DQA conducted in March 2024. And for the information and ICT, we are also proud to say all health facilities in the 16 districts are now using electronic form of reporting. And also for the sustainability, the IDSR curriculum has been introduced and is still sustained in all public health institutions. The investment was mainly focused on indicator-based surveillance, but less on event-based surveillance. And this is the robust surveillance system of reporting. Information is being gathered from the PHU or hospital up to the national. And because of the robust surveillance system, if we are able to meet the timeliness of the weekly health facilities to 94% and completeness, and also the accuracy of data because of the consistency in supervisions and data quality assessment, we have now reached the peak for data accuracy for 98%. And also for the timely detection and notification, it has increased to 97%. And for the rapid response to notify suspected outbreak, it's also improved now to 98% due to the introduction of the EIOS system. And this is the implementation between indicator-based surveillance and event-based surveillance from 2020 to 2024. As for the indicators in the indicator-based surveillance from 2020, all is strong except for the response and outbreak of alerts. It was average, but as of 2024, we are proudly and boastfully say it's strong in Sierra Leone. And for the event-based surveillance, all the indicators were weak because there was no governance, no nothing. And the only thing that was average, it was response to outbreak and alerts. But we are proudly to say 2024 event-based surveillance is now strong in Sierra Leone. And this is the implementation of EIOS in Sierra Leone. Trainings was done in 2021, and with a follow-up technical support from the WHO, AFRO, US CDC, and also WHO in country. 2 EBS analysts were designated at the Ministry of Health, and we're also receiving a follow-up technical mentorship from JPIGO, US CDC, Nigeria CDC, Africa CDC, and WHO. These are the EBS products. We have our daily intelligence reports. We have our EBS workflow. We have our DHIS2 event management systems, and where we are EBS SOPs, and also the 717 matrix. And this is the EIOS sources of Sierra Leone. We have social media, online newspapers, mainstream, rumors from communities, and also media sources. We also organize bi-weekly and monthly EBS meetings to improve the implementation of EBS. Operationalization of the EIOS system. Trainings, we have had 3 trainings. The first 2 was done in 2021, that was in June and November. The last training was done in January 2024, but it was online training and only lasts for 1 hour. And the purpose of the training was to creating of board, EIOS board, pinning, flagging, marking, and unmarking, and also to communicate and send in EIOS community or specific groups, and also to chat for the time period. If you want to chat for the one, or you want to chat for EIOS system for 1 week, 2 weeks, you can go to the time period and do the adjustments from this point or this point you want to start. Then the EIOS community in the chat location will help you to do that. And also the selection of categories, just like Madam Raquel's presentation yesterday. And also we are also scanning for the geographic areas. We are only focusing on the Mano River Union, which is Guinea, Liberia, Nigeria, Ivory Coast, and Ghana. Yeah. And this is the use cases of EIOS in Sierra Leone. EIOS fits into the weekly EPRG meetings, which is the Epidemic Preparedness Response and Resilience Group, which is normally held in Sierra Leone in the EOC every Wednesday. It is the One Health approach, where all different ministries, MDAs, partners, stakeholders meet to share their experiences, challenges, and recommendations. And also the EIOS, we have also succeeded in integrating the EIOS to our EBS event management system tools, and we have pinned it to the all hazard board. So when you are on the EIOS, you want to pin something into the DHIS2, just go to the all hazard board, pin, go to the DHIS2, refresh or clear cache, then you can see what you have pinned to the EIOS system. And also reports We also share reports to the Ministry of Health, national public health agencies, and partners and supporting partners from our country. This is the screenshots of the information shared. This is the weekly PRG meetings. This is the EIOS system that is being pinned on the DHIS2. This is the screenshot of the all hazard boards that is being pinned to the EIOS to reflect on the DHIS2. And this is the weekly or daily intelligence reports that we normally share to partners and other stakeholders. And this is the EIOS workflow. We followed the EBS workflow. You know, for the steps of EBS, we're having 5 steps, which is from the detection to the response. And this is the workflow we use for the EIOS. For the detection, me as an EBS analyst, I scan the media. I'm not only focusing on EIOS. We have different medias that we use to scan the information. After we scan, we also monitor the DHIS2. We have in 2 platforms. We have the EIDSR and the IDSR, which is the weekly reporting and the monthly reporting. And we also monitor all our local medias, newspapers, rumors, or local information. And we alert. You know, when you detect, you have to alert. We alert to see if the things we have monitored is of public health threats to the country or to the environment. Then we have to alert the DHSC, we have to alert to the national surveillance officers, the laboratory, the risk communications, etc. And also we share reports for the EPRG meetings, just like I mentioned, every Wednesday is a fixed date for the EOC. And we verify. We involve the RRT, which is the rapid risk assessment. We also involve the subject matters experts, and also we continue to scan to see how far is to know the risks of the disease that we are scanning. And we go to event management or risk assessment. Here we develop the AIP, which is the incident action plan. We also continue the assessment to see the situation and also support in the daily or media briefing. Then we come to respond. We respond if the disease is public health threat, then it has been confirmed, then we activate the EOC because it has been declared as a public outbreak. We declare the EOC. We also involve subject matter experts. We also require the development of the DRR, which is the district rapid response teams and the national rapid response teams to see how the situation works. This is the workflow. The DHIS2, rapid surveillance officers, event management, the director, incident manager, surveillance, all the pillars of the epidemiology works in for the response mode. Next slide, please. And key results since joining the EIOS. EIOS has helped us in the timely detection and preparedness for outbreaks. It also helped us to generate reports from partners in aiding in decision-making and also improve the collaboration within national and international health partners. And this is this is a case scenario, but we are having an alert from the EIOS board saying there was an outbreak of Ebola in Guinea. So we were in touch with the EIOS focal and the surveillance focal people, but the only barrier is they speak English, French, sorry, I speak English. But if you want to communicate, unless I have to find someone from the Ministry of Environment or Animal Department, so he can translate, I can speak English to him, he can translate to them. And it was found out that the rumor is true, that there was suspected Ebola outbreak. They do the risk assessment, collected samples, and it turns out to be negative of Ebola and turns positive of Lassa fever and Marburg. And I also continue to scan and share the information to the ministry partners and also Sierra Leone embark on a simulation exercise to test the country's preparedness and response and readiness in case there is an outbreak of any emergencies or outbreak. Then to see how we have built our capacity in surveillance and other pillars to see how well we can respond to these diseases that have been detected. And also the challenges encountered using the EIOS in Sierra Leone. Limited keywords in our local dialects and sources also available in Sierra Leone, which can affect the comprehensiveness of our surveillance, and also the technical challenges in integrating the EIOS data into the existing surveillance data we are having. And the lessons and best practices. The continuous training and capacity building are crucial for effective use of EIOS in Sierra Leone, and also the collaboration with countries and international organizations enhance our surveillance capabilities. And also the multiple media sources improve the accuracy of timeliness of information sharing. And our enablers, support from the International Health Organization and partners, also have the technology tools and platform, also strong governmental commitment to improving public health surveillance and the measures of success. EIOS has really helped us in timely and accuracy of outbreak detection, and also the number of actionable reports generated and shared, and also improve times and potential health threats. And plans for strengthening the EIOS initiative, we are also completing the setup teams and ensuring all members are adequately trained on EIOS, and also finalize and implementing the standard operating procedures, which is the SOPs, and also expanding the range of keywords and local languages from sources monitored to enhance data comprehensiveness, and also to collaborate with the regional and international health surveillance networks, and also continue the capacity building and technological updates to support this initiative. Thank you.
Thank you very much. Very good presentation. We have heard, or we have seen two insightful presentations. The first one from Dr. Freddy Kambale about how the Regional Office for Africa is using EIOS, but also building capacities across the region by ensuring that member states are onboarded and are able to use this system. And now we have had a very good presentation from Sierra Leone showing us, since they joined the initiative in 2021, how they have used the EIOS system for scanning. And we saw a use case scenario where an outbreak of Marburg and Lassa fever was identified through the EIOS system. And some of the innovations around importing articles from the EIOS system into the DHIS2 platform was something I think I pick up from this discussion. So very good presentation so far. So just to remind you, colleagues online, this is an experience sharing section on the EIOS initiative. In the African region, we are listening to communities that have been part of this initiative, sharing with us their experiences, their challenges, and the lessons learned on how we can better strengthen the initiative in the African region. Please post your questions in the chat if you are on Zoom, and we will read these questions out if you need to do so. So, distinguished ladies and gentlemen, now over to you. If you have questions or comments, we'll start with the room. Yes, Ifiane.
Matter. In fact, she was one of the people, the team that came to train us in the Gambia. She was. Yes.
Please speak closer to the mic so that those online will be able to hear you.
Yes, I was saying that I'll be giving her some accolades, that she was one of the team members that trained us in the Gambia. Now, quickly, a comment and go into event management. I noticed that event management are mostly activities of PHEOC.
No, Zoom estaba. Está aquí rek baax Dañ ko branché waat.
Let's move to this. The popular containers, the first Okay, one more. And coming down to the south.
Waaye foog ma génn suma du gisaat kii du gis caméra bi
There you are.
Okay, so colleagues, sorry, we are having some technical issues, and we're trying to resolve it as soon as possible, so that you can join the room live. We've just had a presentation from our colleagues in Sierra Leone, who share with us their experience on the EIOS initiative. Since joining in 2021, they have conducted 3 trainings. They have a dedicated team using EIOS to scan the media daily for potential signals about outbreaks and other health events occurring in Sierra Leone and the neighboring countries. And they share with us a case, a scenario where they detected an outbreak of Marburg and Lassa fever through the use of the EIOS system. They also highlighted that this system has really helped with fostering collaboration, communicating with partners and decision makers within the country, and they are generating these reports from the EIOS and other event-based surveillance systems that they are using in Sierra Leone. So it has been, we also had a presentation from the Regional Office for Africa delivered by Dr. Kambale, who shared with us how AFRO has used is leveraging the EIOS system daily, scanning the media using an all-hazard approach to detect public health threats in our region, but also building capacities across the region by expanding to member states. And so far, over 1,000 users have been trained in 36 countries across the region. And there are plans to do more. There are upcoming events. Some of the challenges revolve around high volume of signals, but they are using machine learning techniques to be able to trim down the noise and have few potential signals that the team can triage. So it has been very interesting year, and we hope that you will zoom into the room soon. If you have questions, please do not hesitate to post your questions in the chat. We will read them out and you will get responses to your questions. So now we will invite the third presenter. The third presenter is Dr. Musongwe Simwaba, Davie Simwaba. He is the coordinator of event-based surveillance at Zambia National Institute of Public Health. Concurrently, he is also the inaugural chair and current chairperson of the event-based surveillance community of practice in Southern Africa. Dr. Simwaba is a medical doctor with 2 master's degrees and has several years of experience in public health surveillance. So it is now my pleasure to invite Dr. Simwaba, who will share with us the experience of the Zambia National Institute of Public Health since joining the EIOS initiative. A hand of applause to.
Thank you so much, Dr. Davie, for that wonderful presentation and introduction. Indeed, my name again is Dr. Simwaba, coming from Zambia. I work under the Zambia National Public Health Institute. I've been involved with the institute since 2019. Initially been taken to the institute as a person responsible for implementation of event-based surveillance. The background to this is all well known. I think, like many countries, the country underwent joint external evaluation, where the international health regulations for capacities were measured, and one of the big gaps that the country had was to do with event-based surveillance as one of the capacities that we needed to include within the public health system. So allow me just to run through the presentation. It's good that the last 3 days, most of our colleagues have gone through many of the talking points, so I'll run through it quickly. Next slide, please. Yeah, as for the layout of the presentation, I think it's basically the same like our colleagues have said. But I'll just jump into the presentation by just saying that, like any country, we are guided by some technical guide in terms of implementing health security. And like we've learned,
DSR is one of the strategies that Africa is using. And we learned again that Africa, with an exception of Nigeria, has adopted and implemented strategy. So for us as Zambia, we've been implementing this strategy since inception, I think. First edition, now we are in the 3rd edition. Within the context of the 3rd edition, one of the new elements is event-based surveillance. And to that effect, that's why you see that came up with a guide to help us implement event-based surveillance. But alongside the guide, it's important that you also build infrastructure around the issues of data management. That's why we have a data management which is electronic based at district level, but we still are building capacity at sub-district level to transition to electronic. Next slide. So zeroing in the event-based surveillance guide for Zambia, we have 9 modules, and the key modules that speak around approaches that we have to implement in the context of Zambia. Speaks about the community event-based surveillance, speaks about the health facility event-based surveillance.
We are also implementing the call center or the hotline surveillance. And lastly, the media scanning surveillance. So the media scanning approaches for Zambia started the moment I was brought into ZNPHI in 2019. And initially we were using manual manipulation of gathering information from, meaning you have to have a list of sources which you have to manually manipulate and get your articles, enter them into Excel sheets, which was cumbersome. But we transitioned a bit again to subscribe to other sources, which were semi-automated, the GFIN and others that we're using. But we are lucky enough now with the introduction of the EIOS, most of our works became easier because this is like a major aggregate of articles, which is superior to whatever we're doing. So I'll zero in into just talking about the EIOS and what we've done. Maybe the next slide, please. So for the country, like Dr. Fred has already alluded to, Zambia was onboarded in 2022 with 25 participants that were offered the training with support from WHO, AFRO, and also the Africa CDC. So we have now a community that has been established, and through this community, we've created 3 teams that are responsible for managing 3 boards that are One Health in aspect in outlook, that is the animal health, environmental health, and human health. Of course, we've designated a manager who is responsible for managing the community, and we also are we have established now the media monitoring mechanism or team at national level, which is doing the work. To aid with the information sharing across the community, we have an ad hoc WhatsApp group, which is helping us to share real-time information for purposes of sharing or communicating across the members. And what is key, again, with support from WHO AFRO, we had adopted a template which they use to develop the SOP for implementing epidemic intelligence from open sources. And that is the tool that guides the day-to-day implementation of our EIOS. Within the tool, within the SOP, we have our objectives, which are clearly outlined. We have the teams that are clearly spelled and their roles. We have the tasks that have to be carried out from detection to the issues around reporting which have been laid down within the SOP. So it's a day-to-day, step-by-step tool that helps us focus our work as we implement, though there are weaknesses which I'll speak about. Of course, now the signals have started being detected, and that is being shared in the weekly bulletin. I'll show you some of the extract. Next slide. So in terms of the guidelines that I was talking about, this is the EBS. Oh, sorry, it's screen sensitive. So this is the guide that I was talking about, and we've been implementing using the guide since 2022. But prior to that, we're using the Africa CDC framework for kickstarting our work. What is peculiar again within the guidelines, we have those 4 approaches I spoke about have their specific SOP. So within the media approaches, we have this SOP that, or this information flow, which has been extracted from the SOP, which tells us how information flows. Because you remember, using the EIOS sits at the national level where you use the system, you detect, you triage, but the issues around verification, the issues around risk assessment is done at sub-national level. So this is more or less explaining the way the information flows, because Zambia is geographically or administratively structured in a manner where you have the national level, you have the provincial level, you have the districts, and you have health facility level. But if you talk about the community, where also we have some programming, you have to understand the context of how the information would flow. And it has implications in terms of how quickly the verification will happen, because some of the things may not happen clear at district level. So you have to go straight into the community for you to pick up and verify some of the signals. So it's not a clear-cut science, but it has its complexity. So you have to think through on how you implement it in your own country. But for Zambia, this is a structure. I believe from my nephew who's coming from Nigeria, it's even complex because it has those states, and I don't want to do much. We'll hear more from him. Then, as I mentioned, we have what is called an EIOS standard operating procedure, which I've already spoken about, which we developed thanks to WHO AFRO guidance, which we are using at the moment. Next slide. So one thing is to have the system or the electronic system, the EIOS sitting on your desk. The other thing is to ensure that you start logging in the detected signal into a database. We heard from Malawi, they're using an Excel rumor log, but in our case, we have, with support from Africa CDC, developed what is called an event management system, which is more or less a DHIS2 instance system. So this is the one that we used for logging in all the signals or events that are picked from all the 4 sources that I talked about, and the EIOS is one of the sources. So I deliberately chose this one because here you can see that the source which is speaking about is a source of this signal which was picked in Chipata being entered as from its source, which is the EIOS. Then weekly, we have a line list which is generated in terms of whatever was logged is logged in the system for purposes of data archiving, but also following through what activities they've done. An example of this one was a fortunate one where he went through almost all the processes, but many times you'll find that some of the signals are not complete in terms of the downwards tasks that need to be performed: verification, risk assessment, response. So that is one of the challenges that we also face. Let's go to the next slide. So this is just to showcase that within the system, processed data from the provinces, and this is just from 2002 to 2003, where we had 464 events and signals combined being detected within the system. So more or less, this is the entries to say that our provinces are interacting with the system, but I know there's a lot of challenges along the other tasks that we need to perform. Next slide. So it's important, like everyone has been mentioning, that it's important that we share the information in a more structured manner. And within the EMS, we are able to generate every week an automated report. So this report is more of a serious report, but we're in a stage where we want to make it more summarized, where we can have themes summarized in a more efficient way. But it's a tool or a report which we are able to generate from the EMS. But now we are also incorporating within the epidemiological bulletin, weekly bulletin. This is as of week 31 recent. So we also have this EBS being incorporated within the system. So within the system, I know one of the things that spoke about was measurements of the program. We have an M&E framework, just basic aggregates to measure some of the steps that are contained within the EBS. And of course, we are interested that the information is used. Next slide. So in terms of using an example on how the initiative, the EIOS initiative, has helped us as Zambia, I think this is just one example, but we have many examples we would have given, anthrax being one of it. But I thought the big elephant for Zambia is cholera, which we've just come out from. So we have a situation where the country has just come out of the cholera outbreak. Of course, the outbreak started as early around 16, 18. First picked up from a health facility using indicator-based surveillance. But along the way, we saw how event-based surveillance can be a tool to complement indicator-based surveillance, because we saw that some of the cases, especially mortality, was happening around outside the facility. So the community-based events surveillance was a tool that used to help us pick most of these deaths that happened outside actually 59% of the 740 deaths that were captured. But the other, moving away from ABS, but specifically talking about the EIOS, is the issues of using the One Health approach to pick ecological factors, such as flooding that exacerbated the outbreak in Lusaka and the fishing camps, and also understanding how the declaration of drought within the context of the same outbreak also shaped the evolution of the outbreak. So in short, this is just to say we can triangulate information from the EIOS, getting ecological data to understand a bit of what is happening around an outbreak. So in the context of Zambia, this is just one example that we used to inform how the evolution of the outbreak and also the issues around preparedness, not preparedness, but response, heightening our response mechanism. Next slide. Thank you. So anyway, I've spoken around this already as next slide. So talking about enablers, obviously the EIOS onboarding training was a critical step for Zambia. The development of standard operating procedures for our community on how to implement epidemic intelligence was very critical. Having dedicated staff, initially we had two, meaning myself coordinating EBS, but we had a manager specifically for EBS who since moved, but we now have another person who's been designated to run with the EBS at national level. So the issues around having a data management tool is key. In our case, we have this electronic tool to manage our data, which is the event management system. And obviously, what is key is that we must have internet and also laptops that we've procured for ourselves. The other thing is partner support is quite key. And in Zambia, we are blessed that we have many partners that I'll show. And working within the partnership, I think as a country, we managed to get the pandemic fund, which is driving the health security agenda, and EIOS is one of those things that has been co-opted. The last one is speaking about, in our region, we have 10 member states, and within the member states, we have what is called the Southern Africa Event-Based Surveillance Community of Practice. And one of the key indicator activities we are following is that of implementing the EIOS. And within this platform, we've been lucky to share information, to communicate, and also to collaborate among ourselves. I think we've collaborated around issues to do with cholera. Zimbabwe has been very, very consistent sharing. Zambia has been consistently sharing. South Africa has been sharing the issues around mpox. We have Angola has been sharing on polio. So it's a very interactive platform, which is a WhatsApp platform, but using information that is generated from EIOS and other platforms. Of course, the Africa CDC shares their epidemiological bulletin, which is EBS bulletin on the platform. Next slide. Sorry, no, before that, I think it's the issues of our challenges. I know these are enablers. Challenges are to do with, inactive. We had 25 members who were trained, but not all of them were active on the system. So that is the big challenge for us, and we need to address that. Then the manual entry of signal into the electronic IS, management system. I think we are in a process of addressing that through the support of WHO. And we've since updated our sources, which was a key limitation for us. And we are also thinking that we can utilize the One Health sector much better through the use of the strategic plan which Zambia has developed. Then the issues of local language, I think the sources, that one, categories, I think it's a lesson that we've all learned, and is one of the challenges we hope to address. Next slide. So this, the Southern Africa community of practice, I've already spoken about it. Maybe we can move to the next slide. Yeah, so I think within the context of EBS and EIOS, what is key is to see how we can operationalize this strategic document, which is the One Health strategic plan, and in the long run, but specifically, these are some of the things that we've already spoken to. And I believe this will be my last slide, and we hope we can be supported. Thank you.
Thank you very much, Dr. Simwaba, for this very important presentation. And I think we heard very clearly that EIOS is an intrinsic part of the event-based surveillance program or implementation in Zambia. And so I think that came out very keen in almost all the slides I was hearing: EIOS, EBS, EIOS, EBS. So it shows that they've done a lot of work since they got onboarded in 2022. We also saw the number of signals they've picked up, but we also saw an important use case scenario where they use the EIOS system to collect contextual information that could explain the dynamics of a cholera outbreak, which is something very, very important. So now I will turn to you. We'll start in the room and then we'll go online for questions and comments. Emmanuel. Anwar. From Nigeria, please.
Okay, thank you very much to Dr. Simwaba for a very energetic presentation about their country's experience. I'm interested to
Okay. We'll take few. Emmanuel from Tanzania.
Thank you. Thank you, Dr. Simwaba, for a very nice presentation. I have a question regarding the signals that you said that you detected so many signals, but few were verified. So is there any plan maybe to counteract that kind of challenge that we're facing of signal verification? Thank you.
Okay. Dr. Kumalo from South Africa.
Thank you, Chair. And thank you, Doc, for your presentation. Yes, mine is on the hotline. We have seen that it's a little bit tricky to implement it. So how are you managing in Zambia? Thank you.
Great. Any other question? Do we have questions from online? Okay, we'll take the first 3 and then we'll go online. So colleagues online, please be on standby. Just post your question in the chat and we'll read it out to the presenter. So Dr. Simwaba, over to you.
Yeah. Thank you, Anwar, for that question. Regarding the regional community of practice for event-based surveillance, I think through the Africa CDC, they have regions that are implementing or spearheading the issues around health security. And within their event-based surveillance space, they have the agenda to create these communities of practice for purposes of sharing information around around member states. So in the context of Southern Africa region, I think we have 10 member states that are part of that meeting, which was hashed in Maputo, Mozambique. So I'm the current chair, then we have Lesotho as the deputy, then the secretariat still remains Africa, CDC, Southern Africa Center. Yeah, so it's an initiative which is within the framework, so it's to follow through that, or through your region, you can also form that because it's one of those indicator activities that we are following through. Then for my colleague from Tanzania, definitely the EIOS is mainly done at national level, and the function there is mainly just detection and triaging. So the aspect of implementing the I would say the follow-up activities are done at sub-national level. So it's important that within the framework of event-based surveillance, you reach out in terms of EBS. In our context, the health facility EBS is key, the community EBS is key. Those districts to be able to verify, do risk assessment, and also do the downstream activities, because you remember the ownership of the system, once I log in at national level, in terms of the downstream activities are supposed to be logged in by that particular district. So we follow through, but there are peculiar challenges that need to be addressed, and one of it is the issues of training to ensure that everyone is on board and follow up technical support. For the hotline at the moment is undergoing some reorganization. I think it worked well during the COVID period, which was disease specific. It has worked well during the cholera, which again was disease specific, but that was not the aspiration of what we want from the infrastructure. So we want to reorganize it in a manner that it speaks to the intended goal, which is all hazard continuous across most of the diseases here.
Thank you. So we go online and we have a question from Hannah. Thanks for experience sharing. Will you elaborate more on community-based surveillance? What diseases are included? How do the community reports and to whom? Has there been any troubles and how did you manage them? Then the next question, do you enter signals detected via EIOS manually into DHIS2 or is it collected electronically? So please, the second one is on EIOS. The first one is more broad, so manage your time. You have just a few minutes.
For the signals or events that are detected through the epidemic intelligence from open sources, currently we are entering manually into the EMS, but there are works underway that need to automate that in terms of having what is called an EIOS importer within the EMS DHIS instance. The other thing that we need to do is having a combo within the EMS, which tends to compress that series of reports that are currently captured within the ZNPH, within the weekly report. Community EBS, community EBS, we've rolled out and definitely in two phases. One, it's a pilot project using the mHealth or the phones. The other one is that of paper-based processes. So we've reached out to 87 districts out of the 116, and so far, I think it's one of the many sources of the signals that we are seeing.
Thank you very much. So this is something we are also working on. Sierra Leone is already able to do that. We can generate APIs and link systems so that you don't necessarily need to manually record signals from the EIOS into your national systems. I think we've done that in a few countries already. Sierra Leone is able to import, and we've started that process with Zambia. We've generated the APIs to connect the system. So If you are using the EIOS for media scanning, for instance, you can just pin and input into whatsoever. We try to build that interoperability layer between systems because this is part of our EIDSR strategy. So just to address that, I think it's in the process here. So thank you, Dr. Simwaba. We have one more. No. Wait. We have one more question from Victor. Oh, okay. Okay. This one was not for you. So you are fine. Thank you very much. A hand of applause. Okay, so this has really been an interesting section, but this was just on DHIS2. I think particularly for Sierra Leone, because you mentioned you are already inputting from EIOS into DHIS2, and this person wanted to get guidance. I think Victor from Kenya wanted to get guidance on that. But this also tied to what I just said, that we are generating APIs, and those APIs help us to build interoperability layers between systems to exchange information. And so with those APIs, you can link your systems to the EIOS system. And this is a work that is, we are supporting a lot of countries in this area, and this is work that is ongoing as well. So colleagues, I think we are on time. Thank you so much. It has been a wonderful experience sharing section. We have learned a lot from the different presenters. Please, can we give another round of applause, hand of applause to our presenters? Very insightful presentation. So thank you so much. And with this point, at this point, I will declare this webinar over. Thank you. You can join us at 2 p.m. for the next webinar, which will actually be a roundtable discussion. We'll be hearing from, again, a team of experts, expert EIOS users who will share their experience with us as well. So you can join us again at 2 p.m. Dakar time for another round of discussion on EIOS. Thank you and see you later.
Really well. It's not easy.
Good.